Welcome to Adapt NCLEX. Thank you for deciding to watch this video. Do you want to know how they will ask you questions about fundamentals in case form for the next generation? I think you should stick around. So stick around and see what fundamentals will look like in the next generation. Strategy for answering these kind of questions: read a question, follow through with them. Whatever they take you, go. Read it carefully. Pay attention to buzzwords. You hear me saying buzzwords. Those are key information you should watch for. There will be distractors. I will mention them, but keep on focus. Laser focus on the buzzword. Don't boil down unnecessary stuff and keep on going forward and see what they have for you. So that's the strategy for answering case study. Okay. Client is in emergency room. That tells you something is wrong. Good. It's a buzzword. A 65-year-old female, very important age, present to the emergency room with complaint of what? Drainage from a mastectomy incision. That's a key buzzword. She underwent bilateral total mastectomy. Pay attention. Bilateral total mastectomy, a buzzword, with lymphadenopathy. Modified radical mastectomy. That's what it is 7 days ago. Report of mild fever at home. A pain was 5 out of 10. She has not taken any pain medication for 3 days. Distractor here. So, patient had mastectomy 7 days ago for breast cancer. Now, drainage from one of the incisions. Past medical history. She has left breast cancer. She has mastectomy. She has no allergy. She went on with oxycodone and doxycycline. What is the vitals? She's slightly, temperature is high. 100, low grade, heart rate 100, blood pressure 110/70, respiratory of 18, sadly 98%, 99%. She's not in acute distress, heart fine, lung okay, left breast, there's a purulent drainage from the wound, buzzwords, there's erythema, buzzwords, there's tenderness, and staples are in place. Then a physician order some CBC to be drawn, start IV fluid, and then vancomycin 1 gram to be given. Guess what? All I've told you, you have to summarize it quickly. A 65-year-old female who has a left breast cancer had a total mastectomy, modified radical mastectomy on both sides 7 days ago. She came in with the left breast, looked like infected. That's all. And you keep on moving on. And the physician has ordered some stuff. Paying attention to the buzzwords, okay? Now, because of the orders, the nurse placed a 20-gauge IV in the left antecubital position. That's a buzzword. Blood was drawn. Adult-sized blood cup also was placed on the left arm. A CBC white count came back to be 14,000, signs of infection. And vancomycin was started. Which of the highlighted information need further intervention? Think about it. We have a patient who just had mastectomy, okay? Bilateral mastectomy. And all of a sudden, she came in with the signs of infection and an IV placed in the left arm. Okay, blood pressure cuff placed in the left arm. Okay, infusion of vancomycin, which is a vesicant, in the left arm. Okay, what do you think is going on? Anybody who has mastectomy, especially modified radical mastectomy, no IV in the extremities, no blood draw in the extremities, no vaccine giving in the extremities, okay, no blood pressure cuff in the extremities. You need sign at the bedside to say this patient has mastectomy, okay? And then the extremities should be a little bit above the level of the heart. All these things should be available to the patient. But guess what? What do? We head in the patient. So which of these need intervention? This is plus manual scoring. You pick those that you're confident. If you're not confident, don't pick it. Not all the 5 answers are maybe right. There's some all the 5 answers will be right. If you're confident of 2, pick only 2. If you're confident of 1, pick only 1. But I want you to pick all those that is a right answer. But if you think you're already confident in one, just pick one. No pain medication for 3 days is a distractor. History of breast cancer, there's nothing you do about it. She already had breast cancer and she already had surgery. Nothing we can do. Drainage from the wound. Yes, this is good. 20 gauge IV in the left arm. We have a problem. No IV in the extremities that she had a mastectomy. Vancomycin infusion through that left arm too. Good. So she cannot get IV in the left and the right upper extremity. She can go to the lower extremities, but this, no, we can't do that. So 3, 4, 5, we have to intervene. Once again, plus minus scoring, be confident about your answer. If not, pick those you're confident. Don't guess, never guess. Then what happened? 10 minutes after the vancomycin infusion was initiated, patients started complaining of flushing buzzwords, erythema buzzwords, peritonitis buzzwords of the face, neck, and chest. Why these areas alone? Buzzword. She also report of dyspnea. This is the distractor. Okay. Select 2 actions the nurse should prioritize. So we started the vancomycin, which is a vesicant. All of a sudden, we are flushing, okay, erythema, and pruritus of where? Face, neck, and chest. This is not, and we have dyspnea. I put it there to distract you. This is not anaphylactic reaction. So it's not anaphylactic reaction, okay? It's what we call red man syndrome. It's the face, the neck, and the chest. And it's due to rapid infusion of the vancomycin. Okay. Vancomycin should be infused less than at least 60 minutes. Okay. No, at most 60 minutes or 10 milligram per minute. Okay. That's the way you should not go past 10 milligram per minute of vancomycin infusion. And this is no allergic reaction, so you don't need to treat it like an allergy. Therefore, I say pick 2. So just pick 2. That means 2 answers are here. And it's 0-1 scoring. This one, you're not going to lose the point. But you only pick 2. If you pick 3, you can go forward. You got to just pick 2. I want you to pick 2. You're not going to get it anything point deducted. If you don't get the right answer, you just get 0. It's epinephrine injection. No, this is no allergy. Rapid response. You don't need to call them. Slow down the infusion. Excellent. Prepare to intubate the patient. You don't need. It's no allergic reaction. The dyspnea is just a red herring. They will, because of the flushing and everything, they feel like they short of breath, but they are not. Oxygen, yeah, because they have dyspnea, you can give them oxygen. You don't need to put allergy bracelet on because it's no allergy. So C and E are the right answer. Once again, red man syndrome due to vancomycin. This is some fundamentals you have to know. Okay. Now, the infusion will slow down. Like I told you, I want you to pass these exams, give you content. And I'm putting this, you may already know this, but in a case form, and I'm taking you up and down. Just flow with it. That's the way they would do it to you. It's a training process. You can check my channel. I have a lot of videos just to serve as a library. That's all I care about. Library, you go there, you say, oh, this is like a Q bank. You just keep on saying, I solve those questions, and you become used to that. You see? So what is the problem? Which of the following action is initiated? That's another technique. You read the question backward. Which of the following is indicated? Okay, which of the following is indicated? Plus minus scoring. That means if you made a mistake, I'll take a point from you. So you pick those that you're confident. Then you read the rest of the answer choice, the question choice. The infusion was slowed down and programmed to run like we wanted, less than 10 milligrams per minute. 45 minutes into the infusion, patient complained of what? Severe pain, blanching, edema, and redness around the area around the IV, surrounding the IV. And the arm is very cold. Think about it. We have pain, We have blanching, we have edema, we have redness, and the arm is very cold where the IV is going through. We have a vesicant going through extremities. All of a sudden, we're seeing this. This is what we call extravasation. So we have extravasation of, this is not infiltration, it's extravasation. All the signs is the blanching, the redness, the severe pain is your clue, and the edema, and the hand is very cold. Yeah, infiltration, don't do that. Filtration, you won't see all these features. So this is key. That is extravasation. That means the tissue has leaked from the IV, the fluid has leaked from the IV and gone into the tissue. And so we have a problem. We have to remove that toxic chemical from the tissue. That is the key. So you don't just take the IV out right away. You want to aspirate and remove the vesicant as you remove the IV. So yes, of course, we'll stop the infusion. This is appropriate. We don't flush the line. When you flush the line, that means you're pushing the fluid, the vesicant, and spreading it from the area that it has infiltrated. So don't flush the line. Remove the IV. Okay, you don't remove the IV right away. Okay, don't remove the IV. If you remove the IV, then you won't be able to access the vesicant in the tissue. So don't remove the IV because it's an isolated. Somebody will say, well, we got to remove it. Yeah, you got to remove it while you aspirating. So this is incomplete sentence. Disconnect the IV tubing. Yeah, disconnect the infusion that was going through. This is good. So this is wrong. Disconnects the IV tubing going through the IV. That's where the vancomycin is going through. So this is correct. So this is correct. This is correct. Aspirate the IV catheter. Say you leave the IV in and you aspirate it out so that we can remove the vesicant from the tissue. So this is good. Okay. And then remove the IV catheter while you're aspirating. Yes, this action is correct. That's why you should not remove the IV. You need the IV to aspirate and remove it together. Keep the hand at the heart level. This is the trap, okay? The hand should be above the heart level so that fluid doesn't go to the heart. So this should be above the heart level. So this is wrong. Request, I want the fluid to just stay, what do you call it, in the, without not going to the heart. So that's the way, and also help with the edema. Request order for what? Phentolamine. And this is what you're going to use is the antidote. Okay, it's an antidote, and that antidote is what you can inject into the tissue, and that will absorb any other vesicant that is there. It also causes vasoconstriction, so that blood doesn't go, the vesicant doesn't spread and destroy tissue. So this is what you order. Observe for skin necrosis here. The tissue can die, so that is good. File incident report. Yes, whenever you have extravasation, you have to file incident report because of skin necrosis. So this is the action should be taken. Observe for necrosis. Request this. Remove the IV catheter while you're aspirating. Stop the infusion. Don't flush the line. Don't remove the IV. Disconnect the IV tubing and aspirate the IV catheter. That's the steps that you're supposed to do. So the regular step is stop the infusion. Do not flush it. Okay. Disconnect the tubing. Then aspirate the IV while you remove it. Then elevate your arm above the heart, and then other request for antidote like phentolamine. That is what you use. It's an antidote that will help and prevent skin necrosis. And then you observe for skin necrosis. If there is skin necrosis, you file incident report. This is fundamental. Plus or minus scoring. Pick those you're confident. 1, 2, 3, 4, 5, 10 answer choices. And there is what? 7. If you're confident on 5, pick it. 6, pick it. 3, pick it. You don't want to pick all 10. Okay. So that's the strategy. Now, the patient develops skin necrosis. No matter what we did, it's going to be a problem. An incident report was filed. Which of the following is true of the incident report? That means which of this is consistent with incident report? That you have to know. This is 0, 1 scoring. So you can choose all of them, fine, but you're not going to lose the point. So, but I don't encourage you. Just be like honest to yourself and pick those you think you're confident. Usually they won't tell you, okay? Based on what I've seen in the Q bank, they won't tell you until the answer choice. You looking at the rationale and how they score it. So, but if they tell you in the rare exams, yeah, I don't know. I got to ask other folks who've taken it and see if they see the scoring attached to the question. If you see it here, it will be good. But this one, we don't have anything, so we'll work with it. Report. So basically, what he's asking you, all he's asking you is, what is an incident report, and what should it include? That's all. The report actual event. Yes, you're supposed to report actual event. That is what it's for. It's also designed to report a potential when there is a near miss here. Okay, it's a potential problem. So it's an incident report in order to improve. It's a learning process, and it's not designed to be punitive. That's why you have to report both actual and a potential event so that we can improve our process and prevent injury to the patient. Used for quality improvement. Yes, it's not punitive, but it's used for quality improvement. Document fact only. Yes, you don't have to tell about your how you feel about the event. Okay, incident report should be Mr. So and so Smith came in, he fell. Okay, we put him on the bed. He has a head injury, and he get a CT scan. He's in surgery. That's all. There's nothing like he fell because of something on the floor, and because the nurses did not lower the bed down, because we did not, okay, put on the bed alarm, is unnecessary. That's commentary. That's what you think. Leave it to the quality improvement people. Let them do their investigation. So that is the key. So it's just the fact, not what you think happened. Patient fell. We took him to the bed. He had head injury. He's getting surgery. That's all. Whatever you think may have caused it is none of your business. That is the process improvement. They will figure out. So document only facts. So that's what I mean. Confidential information. Yeah, you don't tell anybody. You're not supposed to share it with anybody. You document it and you send it to the quality improvement, and they will have it. It's a confidential information. Okay, so nobody should know about it. Okay, you don't share with any the info. The charge nurse know that you got to file. So that's all. But you're not supposed to out and tell everybody about the report they file. That's why we keep it confidential. Because it's kept confidential, it cannot be subpoenaed in court. So you can't subpoena this because it's confidential. Okay, so it can be subpoenaed, no. But if you lose the confidentiality and you disclose it to everybody, okay, any party that is not supposed to know. So every time it's disclosed, we lose the ability, the confidential nature of the event, and therefore the court can subpoena it. If we kept it confidential, it cannot be subpoenaed. If you disclose it, yeah, it can be subpoenaed. But for now, cannot be subpoenaed. Place final report in the chat. This is why it's the same thing as the F. It's a confidential information. It's just going to the quality improvement people. You don't put this in the chat. It goes to them and they will investigate. So this is wrong. So A, B, D, E, F are the right answer. You pick those in confidence. Okay. This is idea about incident report. Now, I keep on trying to get you your content fundamental, how much you know. The physician finally ordered a 20 gauge, a new 22 gauge IV in the left leg, okay? 40 milligram of enoxaparin and IM of morphine, okay? Which actions are appropriate or not appropriate? Now we have an IM medication for the patient. We're going to give the patient some enoxaparin, and we have to place a 22 IV in the left leg. So which actions are appropriate? This one is checking whether you know IV and what side, what technique. Inject enoxaparin 2 centimeters from the umbilicus subcu. This is a local nurse. Enoxaparin is injected as subcu. It doesn't go through IM. And the places you inject subcu is the abdomen, your thigh, and your upper extremities. The best place is the abdomen. And if you have to inject in the abdomen, 2 centimeters from the belly button. So if this is the umbilicus, you inject it, you measure 2 centimeters. So you can inject it here, 2 centimeters from here. The reason why, if you inject it near the belly button, there's vessels here and they will bleed. And it's subcu. You don't inject it all the way to the muscle, just the subcu, the fat. And you have to pinch. If you can pinch 2 centimeters, then you use 90 degrees. That means the patient is thick. The abdominal fat is thick. So you need to use 90 degrees. But if you cannot, it's less than 2 centimeters, you cannot pinch 2 centimeters, then the angle is 45. So this one injected, yeah, is appropriate. IM morphine, ventrogluteal site. This is the best site, the best site for adult. Okay, you have the deltoid, which is another site, ventrogluteal site, and the vastus lateralis. Vastus lateralis, that is for kids. For kids, the best IM site is vastus lateralis, and for adult is ventrogluteal area. So this is good. Z-track technique for IM morphine. Yes, this is the track, the technique you use to prevent the fluid from leaking. Okay, when it leaks, it's not good. So we prevent it, and that's where you put a tuck in the skin, hold it, inject it, while you remove it. So Z-track technique is very, very good for IM. Okay, 45 degrees for enoxaparin injection. I told you. So if you can pinch more than 2 centimeters, 90 degrees. If you can pinch 2 centimeters, then you inject it 45 degrees. 25 gauge needle for IM. Yeah, there's needle size. Okay, so you have intradermal, and then you have subcu, and then IM. Intradermal, the size of the needle is like 25 to 27. Okay, and subcu also 25 to 27. IM is usually bigger, 18 to 25. So this is good. Massage the IV site. Before that, there's angles, intradermal 10 to 15 degrees. Okay, the subcu 45 to 90. IM is 90 degrees. Okay, and then the needle size, intradermal, let me clean it. Intradermal. So intradermal, the needle size, usually between 1/4 to 8 inches. Okay, the subcu is a little bit thick, so 3/8 to 8 inches. And then IM is usually big, 1 to 1.5 inch needle that you use. Okay, so IM site, massage IM site to allow absorption. That is no. You should not do that. When you do that, then you're causing trauma there. You should not do that. There's no need to massage it. You should not massage it. So this 25 is good. This degree is good. Z is good. IM is good. Injection is good. So those are the good part of it. And finally, hopefully it's finally, like I said, these are all fundamental to test your knowledge. A detailed review of the system, reveal patient has higher risks of fall due to prior fall history. Okay, so patient has high risks of high fall risks of fall due to prior episode. So what would you do? Okay, what will you do for this patient? The patient has a high risk of fall due to prior episode. Which of the following should be included in the plan of care? So plus or minus. That means if you made a mistake, I will take a point from you. So what do you think? Patient has a higher risk of fall. Which of this should be included in the plan of care? Orienting the patient to the room. That's perfect. Call light within reach. This is what usually let them fall. They're reaching for the call light and they'll fall down. Bed in the lowest position. It's your best friend. Uncluttered room, yeah. Take anything on the floor, rags, anything, yeah. Non-slip socks, yes. The room should be well light. Their belongings within their reach, yes. They're looking for their glasses and then they fall down. Bed alarm on so that when they get out of bed, you know they're out of bed. Room close to the next station, perfect. The wristband on to know that this patient is a fall risk, perfect. And an hourly round if you get a chance to help with that so that they don't fall because she's has a higher risk of fall. All of this is right. If you're confident in some, pick it. But there's a bunch of points here. If you think you're confident, collect all of them. If you want to just pick half of it because you're not confident, but these answer choices should be something you know. So you should be able to pick all of them. This is the end of the case. As you can see, mostly fundamentals, but I've reviewed key information you should just know for your test in case you see it in the standalone question. There's a lot of good fundamental in this video. Thank you for sticking around. All the best of luck and good luck. If you have not subscribed, subscribe and look at the links and you see that a bunch of videos on case. And this is the technique. Just be confident, just relax, absorb whatever they give you and go with the flow before you realize your computer is shutting off at 85. That's my job. All the best of luck and keep charging as always. Bye-bye.